Forgetting a name can shake your confidence. It may happen in a small moment. You run into someone at the store. You recognize the face. You remember where you met. You may even remember what you talked about last time, but the name just will not come. Then later that day, when you are doing something completely ordinary, it suddenly appears. For many people after 60, that moment brings a quiet fear. Is this normal aging, or is something happening to my memory? That is exactly where we need to be careful. Forgetting names more often after 60 does not automatically mean dementia. It does not automatically mean Alzheimer's disease. And it does not mean you should panic. But it also should not be dismissed without thought, especially if it is becoming more frequent, more noticeable, or part of a larger change. The real question is not, did I forget a name? The better question is, what kind of forgetting is this? And is it starting to affect my daily life? Names are actually one of the harder things for the brain to retrieve. A name is often just a label. It may not have much meaning attached to it. That is why you can remember someone's face, their job, their voice, or the place you met them, but still struggle to pull up the name in the moment. As we get older, the brain may take longer to retrieve certain information. The memory may still be there, but access can be slower. That tip of the tongue feeling can become more common with age. This kind of delay can be frustrating. It can feel embarrassing. But if the name comes back later, and your daily life is still functioning normally, it may fit with normal age-related memory change. The problem is that many seniors fall into one of two traps. The first trap is assuming every memory slip means dementia. That creates fear before there is enough information. The second trap is assuming every memory problem is just old age. That can delay an important conversation with a doctor. The truth is in the middle. Some forgetfulness is common with aging, but dementia is not normal aging. Memory becomes more concerning when it begins to interfere with independence, judgment, safety, or familiar daily routines. Occasionally forgetting a name is one thing. Repeatedly forgetting recent conversations, missing bills, getting lost in familiar places, mismanaging medications, or struggling with tasks you used to handle easily is different. That difference matters. One possible reason names become harder is simple retrieval slowing. Think of your memory like a large filing system. The information may still be stored, but it takes longer to find the right folder. You may know the answer is there, but your brain needs more time to reach it. Another possible reason is attention. Many memory problems begin before memory is even involved. If you were distracted when someone said their name, if the room was noisy, if you were tired, or if you were thinking about something else, your brain may not have stored the name clearly in the first place. So later, it feels like you forgot it. But in reality, it may never have been recorded strongly. Sleep can also play a major role. Poor sleep can make the brain feel foggy. If you wake up often, snore heavily, feel tired during the day, or never feel refreshed, memory and focus can suffer. Sleep is one of the ways the brain organizes information. When sleep quality drops, recall often becomes harder. Stress and mood matter too. Anxiety can make the mind race. Depression can make thinking feel slower and heavier. Grief, loneliness, major life changes, or long periods of worry can all affect attention and memory. These changes are real, and they can be mistaken for permanent decline. Hearing is another overlooked piece. If you do not hear a name clearly, the brain has less to work with. Many older adults think they are becoming more forgetful, when part of the problem may be that conversations have become harder to hear and follow. There is also the connection between brain health and whole body health. The brain depends on steady blood flow, oxygen, and healthy blood vessels. Conditions that affect blood pressure, blood sugar, heart health, or circulation can sometimes be linked with changes in thinking over time. That does not mean forgetting one name proves a medical problem. It means the brain is not separate from the rest of the body. Medication effects are also worth considering after 60. Some medicines can sometimes contribute to drowsiness, confusion, dizziness, or memory complaints, especially when several medications are used together. Supplements can also interact with prescriptions or create unexpected effects. The safe response is not to stop a medication on your own. The safe response is to bring a complete list of your medications and supplements to your doctor or pharmacist and ask whether anything could be contributing to changes in memory, focus, or alertness. So when should a memory change get more attention? Pay attention when the pattern changes. If forgetting names happens once in a while and the name comes back later, that may be less concerning. But if memory problems are becoming more frequent, if other people are noticing, or if you are repeating the same questions without realizing it, it is worth taking seriously. It is also worth talking to a healthcare professional if memory changes are affecting bills, appointments, medications, cooking, driving, shopping, or familiar household tasks. Getting lost in a familiar area is another sign to discuss. So is confusion about time or place, unusual personality changes, poor judgment, or withdrawing from activities because thinking feels harder. None of these signs prove a diagnosis, but they are reasons to ask for an evaluation. Sudden changes are different. If memory problems come on suddenly, especially with weakness, trouble speaking, facial drooping, severe headache, confusion, fainting, chest pain, or trouble walking, that may require urgent medical attention. For everyday brain health, the goal is not to chase miracle cures. The goal is to support the conditions your brain needs to work well. Regular movement can help support circulation, sleep, mood, and overall health. It does not need to be extreme. Walking, light strength work, balance exercises, or activity recommended by your healthcare professional can all be part of a healthy routine. Sleep deserves attention. A steady sleep schedule, a calmer evening routine, less late caffeine, and a conversation with your doctor about snoring or daytime sleepiness may all be useful steps. Social connection is also important. Conversation, family contact, community activities, volunteering, or regular phone calls keep the brain engaged. Isolation can quietly affect mood, energy, and attention. Nutrition matters, but it should be kept realistic. A balanced pattern with vegetables, fruits, whole grains, protein, healthy fats, and enough fluids can support overall health. But no single food or supplement should be treated as a cure for memory problems. Mental activity can help keep the brain engaged too. Reading, learning something new, playing music, doing puzzles, taking a class, or having thoughtful conversations can all challenge the mind. And do not overlook simple systems. Use a calendar, write down names, keep a medication list, put keys, glasses, and your phone in the same place. Set reminders. These are not signs of failure. They are signs of wisdom. A person who wears glasses is not failing at vision. A person who uses a calendar is not failing at memory. One of the most helpful things you can do is notice patterns. Did the forgetfulness start after a period of poor sleep? After a stressful event? After a medication change? After an illness? After hearing became worse? After you became less socially active? Patterns give your doctor better information than fear alone. The main lesson is simple. Forgetting names after 60 can be normal, but the pattern matters. If the name disappears for a moment and returns later, and your daily life remains steady, it may be part of normal aging. But if memory changes are worsening, affecting independence, creating safety concerns, or being noticed by people close to you, it is worth having a medical conversation. Not because you should be afraid, because some contributors may be manageable. Sleep problems, mood changes, hearing issues, medication effects, vitamin deficiencies, thyroid problems, and blood sugar concerns are all examples of things a professional may consider. And if something more serious is developing, earlier evaluation can help you and your family plan with more clarity. So the next time a name will not come, do not immediately assume the worst. Pause and ask a better question. Is this an occasional delay, or is it part of a larger pattern? That question can turn fear into awareness. After 60, the goal is not to remember every name instantly. The goal is to understand what your brain may be telling you, notice meaningful changes, and ask for help when the pattern deserves attention. If you want more calm, practical explanations about health changes after 60, subscribe to the channel. We focus on the body signals many people overlook and what they may mean for staying independent, informed, and healthier as you age.